Good afternoon. My name is Jalisa, and today we'll be talking about STDs. An STD is a sexually transmitted disease. There are many different types of STDs, such as chlamydia, gonorrhea, HIV, AIDS, and trich, and herpes. Our first STD is chlamydia. Chlamydia can be found in men and women. It comes from having unprotected sex, whether it's anal sex, oral sex, or vaginal sex. Symptoms can be hard to detect because most people don't develop symptoms. But symptoms in women are vaginal discharge, painful urination. Symptoms in men are the same, but the testicles can swell up due to contracting the disease. Chlamydia is curable. You treat chlamydia with antibiotics prescribed by your doctor. Our next STD is gonorrhea. Gonorrhea is an STD that can be also found in men and women. You can contract gonorrhea in your rectum, the throat, and the genitals. Symptoms in women are thickening discharge and abnormal vaginal bleeding. Symptoms in men are yellowish, greenish, and whitish discharge from the penis. Gonorrhea is also curable, but nowadays it's becoming harder to treat because it's becoming drug resistant. Our next STD is trich. Trich comes from a parasite found on your genitals. Symptoms in women are fishy smell, thickening discharge, itching, and burning of the vagina. Symptoms in men are burning after urination and ejaculation. Not many people experience symptoms with trich because it's hard to detect the parasites unless the doctor detects it. Treatment is medicine prescribed by the doctor, such as metronidazole or trinidazole. Our next STD is herpes. Herpes has two strains, herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 is orally, where you have fever blisters around your mouth, HSV1 is normally contracted at a younger age. Our second strand is HSV2. That's genital herpes. That is passed through sexual contact. HSV1, you can't contract it through sexual contact. It's orally. It is not curable, so we have to be careful with that. With that being said, you can have medication prescribed by the doctor, but it only prevents or slows down the breakout process. Our next is HIV. This one is a non-curable STD. It comes from having sex with someone you don't know, having sex under the influence, and just having unprotected sex from someone that has the virus. HIV stands for Human Immune Deficiency Virus. There are 3 different stages of HIV. The first stage, which is acute HIV, to where that's when you're first infected and you don't know, so the virus is heavy in your bloodstream. The second is the latency stage, where you find out that you do have it, but it's not producing rapidly. So it slows down the process. If you take medication properly in this stage, then it's a 50% chance that you won't pass it down to your partner, but you still should use protection. And the third stage is AIDS, which comes from the HIV not being treated. That's the last, and that's the most severe stage of HIV. Symptoms of HIV is chills, weight loss, weakness, and fever. How do I know I have an STD? The best thing to do is go to the doctor every 3 to 6 months to make sure you're safe and get a checkup. You and your partner should go to the doctor. prevention. Use protection. Condoms are your best friend. Or you can practice abstinence, no sex at all. That's the best way to be. Then you won't have to worry about an STD. The end.